goodness. That was awesome. Oh, wow. That felt really good.
Okay, so what I want to do, I'm going to ask you, so obviously you have migraines, headaches, right? Tell me a little bit more about it.
Well, usually when it's mainly the migraines.
Okay.
It's I feel it really. It goes up to like maybe like my temple. It goes down all the way to like my shoulders.
Wow.
So I have like the pain all the way from like, it's usually my left side, like from my temple to the neck to the shoulder, like on this area. And it sometimes it lasts for days.
Wow.
And like I said, I don't even bother taking medicine or anything because
Yeah.
like, I've tried so many things, it just doesn't help. Which is why I was like, well, let me try chiropractic, and it did help. But since I stopped going, because I didn't feel like you were saying, it's that place. It was just more like kind of quick. It wasn't really like, okay, let's focus on really what's like your problem.
Exactly. No, that's exactly what we have to do.
Yeah.
How long have you been dealing with migraines for?
Oh my god. I wouldn't say 10 years or more.
That's a lot.
Yeah, because I've been having headaches. Like, I mean, it really started with headaches when I was young. Maybe probably like 8 or younger.
And you are what? 28?
29.
29? Okay.
Yeah.
How many? Was there something in particular that may have happened when you were 8?
I don't know.
Nothing.
No,
it just all of a sudden kind of happened.
So I used to have long hair. So my parents thought like, okay, maybe it's like the weight of your hair.
Right.
Like maybe it's like making your head hurt, you know? So they cut my hair, that didn't help. Then they took me to a doctor, like what if she has a tumor or something?
Right.
Then they're like, no, she's good, she's healthy. So it was just one of those like, okay, well, we don't know why you're getting the headaches.
Yeah.
Now it's just random. Like sometimes I'm good for like a few weeks. And then for 1 week, then I get them and it lasts for like maybe 3 days or so.
Wow.
But it's like, I just feel like all just sore.
Do you notice it coming? Do you you're like, oh man, I'm about to have this migraine. So it just comes out of nowhere.
It's just like out of nowhere.
Okay.
Like one day I'm good, the next day I wake up and I'm like, okay, I wake up with a migraine, and that's when I know, okay, it's gonna be like for the whole day, maybe 2 days.
Wow.
And it just, it takes a while for it to go away.
Yeah.
When I feel it coming, I guess, or it's when I wake up.
That's when you wake up.
When I wake up, that's when it's like I feel the pain. It's small, like minor, and then throughout the day, it just kind of gets worse.
Yeah.
And then it, like I said, it just lasts for like maybe 2 or 3 days.
Do you have any neck pain too?
Yes, I get neck pain. So, like I said, it's just like kind of just soreness in a way.
Yeah. Is it more in the top region here?
Yeah, like here to like my shoulders, where it's like one of those like I just want to have somebody like kind of just like massage it like real hard.
Yeah.
But even that, it's like doesn't help.
Doesn't help.
No.
Scale from 0 to 10 when the migraine's at its worst, and I almost feel silly kind of asking this. When it's at its worst, what would you rate it?
Oh man, I would probably say close to an 8.
An 8?
Yeah, like an 8, because it's up there.
All right, so and what it really seems like to me, and when I see a lot, and I honestly, I get people that come in here with 10, 20, 30, 40 years of headaches, and listen, I've seen so many different weird surgeries that have come in. People have gotten their temporal arteries taken out, they've gotten them freeze, they've gotten injections, they've gotten Botox, they've gotten everything. And only it's a temporary solution, right? So the reason, and there's a reason why. So with your structure, and then I want to differentiate between an adjustment and how your structure is set, all right? And this is really where I'm leading to. When you look at your spine, right, there is a certain way that it has to be. I'm going to focus more on the neck because obviously that's applicable to you. But from the neck all the way down to the lower part of your spine, this spine from you to me should be straight, right? And I think you understand that. Yeah. Now, from the side though, there has to be a curve in your neck, right? So from here down and through here, there has to be a curvature, and if this head is oriented facing this way, this curvature needs to be returned back this way, right? Now, what ends up happening is that maybe, I don't know, something maybe have happened through when you were a kid or through birth or whatever it may have been, but this curvature starts to be lost and it starts to move this way and it starts to be moved this way, right? Now, what I want you to pretend is like, imagine if this is the normal curvature and you have a rubber band that's going from here down to this part, so it's right over here. And that rubber band is only 6 inches long, right? Now, if I lose this curve and it starts to move like this, does this stay at 6 inches?
No.
It doesn't. It's gonna expand,
yeah.
right? Now, the worst part about this is that you don't feel your spine actually moving, right? And as it starts to move, it also takes those muscles and brings it with them. And when it starts to brings it actually with the bones, now you always have this abnormal tension coming from here all the way down to your shoulders. So that tension that you'll feel whenever you feel that headache, a big reason is because, I've never seen what your x-rays look like, right? But I'm willing to guess that you don't have a curvature in your neck, especially when you're having migraines this severe. And for this amount of time, I mean, that's almost 20 years, right?
It's a long time.
Right, so, and that's not normal. And really the normal amount of headaches that you are supposed to have per year is 1, right? And so if you're having, and migraines are just abnormal, right? Because there's a difference between just a headache and there's a migraine. And with a migraine, it can always become debilitating, is what I'm trying to say, right? So what we really have to do, now what a chiropractic adjustment does and what it does not do, is that an adjustment alone does not take this curvature and return it back this way, right? I think whenever you're going to the joint, you're onto something in a sense that it does take that consistency, right? Now, having the quick adjustments, that's not a bad thing.
Right.
The bad thing about that is that, one, they don't take x-rays, right?
No.
And this is not me bashing on them, but this is, because and listen, I've had my own conditions before, to the point where I was almost debilitated from my lower half down. And I've gotten the adjustments 2 to 3 times a week and with no x-rays. And yeah, it helped a little bit, but then as soon as I was done, or maybe a few days later, it would come back, right? And the reason why is because my actual structure just never was addressed. So what we have to do is, 1, we take the x-rays, but 2, we have to see what this curvature looks like. If this curvature is in the opposite way, or if it's even just straight, that's what's going to cause all the headaches, all the neck issues, all the shoulder issues, because when you're, I think you're, whatever your job is, whatever you're doing, right? You're a desk job, right? So when you have this desk job and you're sitting, you're supposed to be sitting up like this, but you don't. There's no right. Bad. And I know, and I can see it. But the thing is, I think sometimes you just can't help it anymore because your body knows and it's smart enough to realize that in the end, you're going to revert back to this posture, right? So what it's trying to do is protect itself from having any further damage, withstanding any further damage, whether. And really, because what happens when you have this type of abnormal posture, it starts to wear on the actual bones itself, it starts to wear on the discs itself, and when it starts to do that, it accelerates the degeneration that's in your body, causing it to die faster. And that's what it doesn't want to do, obviously. So it gets into this position, and you can feel the tightness and the stiffnesses because it's almost acting like a splint for your spine, and it's trying to hold that like this, right? So whenever you have these symptoms, such as the migraines or the headaches, or whatever they may be, it's your body's way of telling you, like, hey, there's something wrong, right? The thing is, when you get out of that optimal way of the spine, that's when you start to have the dysfunction, all right? So we have to treat this, the curvature is going back the opposite way. So if we don't see it, and honestly, that's what differs with this type of chiropractic treatment compared to adjustments, is that what we're looking for is the return of that curvature, right? Once you get that curvature back, honestly, you're not going to have those headaches again. Right.
Okay. Which is like what I'm hoping for.
What you're hoping for,
I'm just
right?
I'm over them.
Yeah. All right. So let's take x-rays on you, all right? And then afterwards, we'll get you adjusted. All right? So you can leave your... All right, so what I wanted to show you guys was why she was actually having the pain, while she was having the headaches. Really, when we're looking at a spine, we're looking for a few things. With her overall, her spine was actually pretty good. But what I did notice was that in her neck, it's a lot straighter than we would really like. So this portion right in through here, it's not supposed to be that straight. What it's really supposed to look like is this. So you want to have that curve. You guys can see that curve compared to this. No curve, curve, no curve, curve, no curve, curve. Okay, you get it. But so with this curve, the reason why we want to see this curve is because right back in through here, you see how there's this green line right here? Well, there's a lot more bone if we were to separate these halves, really, from this half to this half. This half right here has a lot more bone. You can see it kind of looks like dinosaurs. That's where really all that weight is supposed to be. Whenever this curve now becomes straight, instead of this area
having most of that weight. Now all that weight starts to become placed on this front portion, on your throat, on the muscles in that area, the pharynx, the larynx, the trachea. With hers, you can see it's straight. And when it's straight like that, it's putting a lot more pressure. Even the bones are starting to deform a little bit. But you put a lot more pressure, causing the disc degeneration, causing early degenerative disc disease, because that curvature isn't aligned properly. So when I'm adjusting here, I'm really looking towards the apex of this curve, which is right here, and I need to adjust this area to free up a lot more motion in through this area here. Now, with her, she's gonna be on a care plan, so we're gonna really focus on getting that curvature back the opposite way so we can reset how her spine is, really how she's functioning, get her away from the headaches, but most importantly, keep her away from having any more of the headaches. All right, so let's get to the adjustment now. So I'm gonna press down on your head. So sit up straight for me. Good. I'm gonna have you pull this back. I just wanna assess you first. Yeah, so I can see this shoulder joint. Really, it's supposed to be back this way, a little bit further this way. Same thing with this one, should be back a little further that way also. The head is moved forward. They're starting to have like a little bit of a curve. No, you keep your hair like that. That's fine. That's perfect. Starting to have a little bit of a curvature right here also.
Yeah, that's
right.
I don't know what that is, but my grandma, she's like, oh, it's just fat.
No.
But I don't think it's fat.
No.
I think something's up with my bones.
No, it's what it is. It's called the Dowager's hump. What that means is that your head's starting to move a little bit too far forward.
Oh, okay.
I see it more common in women than anything, but it starts because, think of it as if you catch a fish, and I don't know if you've ever been fishing, but whenever you catch a fish and it swims the opposite way, you have to pull it back. So this is that area that's really just kind of pulling it back to the opposite way. As you start to work on the curve and you start to align that spine back to where it's supposed to be, honestly, that hump starts to go away further.
Yeah.
All right.
I need that gone too.
You need that gone too. Along with the headaches and the shoulder issues. Yeah, so much tension in through here. That's crazy.
It's probably from like years of it's just piling up.
Yeah. Your upper traps. Do you get when you get stressed? Is it all the top?
Yes,
right
it's
there?
all here.
Yeah.
Yes.
I want you to look all the way to the right for me. Good. A little bit of limited rotation. You look all the way to the left. Good. You have a little bit better rotation on that side. Do you feel it's a little bit easier to look to the left?
Yeah, it is.
Yeah. Look to the right again. Yep. Look to the left. Good. Look down. Does that hurt at all?
No.
All right. Look all the way up. Good. Still okay?
Yes.
Okay. Good. I'm just gonna press down like this, pretty hard. Any pain when I do that?
No.
Okay. When I pull up, is there any pain when I do that?
No.
Okay. All right. So what I'm gonna have you is you're gonna go face down. So I'm gonna address. Let me see what your mid back looks like. Scoot down a little bit towards your feet here. So I'm going to adjust this portion here first, okay? So I want you to look up a tad bit for me. Good. Take a deep breath in and exhale all the way out. There he goes. How'd that feel?
Amazing. I haven't had that in a while.
That was really, really huge. That was good. Yep.
Good.
In the top area. Let's see your arms. Just like this. All right. You're gonna hold tight.
Okay.
All right. I'm gonna put my hand right behind the top of that back.
Okay.
This way. Can you feel that tension up in there?
Yeah, I do.
Yeah. All right, I'm gonna put my hand right here. I'm gonna push up and you can feel that, right? So I want you to take a deep breath in and exhale all the way out. Let that air go further. There it is. Good.
So good.
Yeah. Good. Got a little bit of your shoulders too.
Yeah, I feel it.
Get the whole change.
Okay.
Yes, there's a lot of tension right there. So we're gonna adjust this lower portion here first, okay? Just relax a little more.
Oh my god. That was awesome. It's
right?
like I feel like something's releasing.
Yeah.
Oh my god, it feels amazing.
You're all right?
Yeah.
All right, we're gonna go to the next side. So this is gonna be right here, right where that C2, C3 is, right there. You can feel that? I'm gonna push just like this. Turn your head a little more. Good. And I want you to relax. Give me your head. There it goes.
Oh my goodness. That was awesome.
I feel like that was needed.
Yes, it was.
How's that feeling right now?
It feels really good. Awesome.
That was big, right?
Yeah.
Okay. Now we're gonna use that Y strap on you. You ready?
Okay, I'm
So
ready.
I'm gonna have you scoot all the way down off the table.
Okay.
This is the Y strap here, right? I'm gonna be placing
my
it on
God.
your. You all ready?
I'm excited.
Okay.
I'm nervous and excited.
You're nervous and excited? Okay. All right, so I'm gonna have you lift your head all the way up. This way, I'm gonna put this underneath your neck.
You're more comfortable.
Yeah. Feel okay?
Mm-hmm.
So I'm gonna be prepping your body just a little bit, so it's not too big of a shock. Do you feel anything popping yet?
No, not yet.
Okay. Good, just relax.
Oh my god. Oh wow. That felt really good.
Yeah.
Wow.
Describe me what you're feeling, how it felt.
I felt it pop all the way back here on my back.
Yeah.
It just feels good. I'm just like, hold on, let me.
Yeah. You have to gather your composure a little bit.
So that's what that feels like.
That's what that feels like, yeah.
It's amazing. It feels more like I don't like. I got a new spine. I don't even know if that makes any sense.
Don't try to come up yet.
Oh god, that feels so good. That was much needed. Thank you.
Yeah. How the shoulders feeling right now?
Good. Everything just. I don't know why I feel lighter too.
Yeah. No.
Am I supposed to feel
You're
light?
supposed to because one, whenever you get that.
Wow.
Actually, when you get the Y strap done, what it does, it opens up a lot of the discs.
Okay.
And the discs are really proportional to how far that nerve can actually exit out. So the bigger the space is, the more your body can actually allow those nerves to get through.
Okay. Yeah, even my shoulders feel like.
Feel better, right?
Yeah, they just feel better. Wow.
Okay. Go ahead and sit up. And then face towards your right or your left. Sorry.
Oh, that was amazing. Finally. Finally.
Finally, right?
Wow. Yeah, it feels really good. Is it true like that I should be a little like taller too? Like when they say like
it can happen. I mean, whenever you have the discs start to shrink a little bit, if you can get the discs to hydrate a little bit. I mean, if you ever measure yourself
Thank you.
Yeah.